This time on Poll Hub, what can pollsters tell us about the statistics being reported on the COVID-19 pandemic? It turns out, plenty. We'll discuss analysis from 538's Nate Silver. Then a subject we've talked a lot about on this podcast, the U.S. Census. By now, you've probably gotten your census form. Hopefully, you've completed it online, but millions of people haven't, and that means thousands of workers are going to need to go house to house to ensure the census is complete. But how does that work in a time of shelter in place, social distancing? We're going to talk about that as well. Plenty to do, so let's get to it. And hi, everybody. Welcome to Poll Hub. I'm Jay DeDapper, Director of Innovation here at the Marist Poll.
And I'm Barbara Carvalho, Director of the Marist Poll.
And I'm Lee Miringoff, Director of the Marist College Institute for Public Opinion.
And just to ensure that everybody understands that we are doing what the CDC and others recommend, we are not in the same room. We are not doing this podcast across the table from one another as we usually do. We are doing it via Zoom, which means that we're all able to see each other and you are able to hear us, but we're all in different locations, staying safe like we're supposed to be, right?
We certainly hope so, and hopefully everyone else is staying safe as well.
So one of the things that I think a lot of people are paying attention to is statistics, a lot of statistics about this pandemic. Specifically, we've been looking at death rates and infection rates, and we hear a lot about how many tests have been completed, how many are negative, how many are positive. It's a sea of numbers. It's a swarm of numbers, maybe a better description. And nobody deals with lots of numbers better than statisticians and people like pollsters. And Nate Silver, known at 538.com, did a really interesting kind of dive into these numbers. And before we talk about what he found, why would a guy like Nate Silver do this? And why would we want to pay attention to him doing, talking about these numbers?
Well, I would just start out by saying that, first of all, I like his work generally, and I know that during this, very, very difficult period that we're all experiencing, and as you say, this sea of numbers that are floating around, I find his to be particularly helpful because I think he understands that this is different than doing political modeling, sports modeling. The data here is very incomplete. And so I find it very interesting how he's able to sort of work us through that in a way that I find very helpful. So as he has given to us, I would give him an A+ in this article. Coronavirus case counts are meaningless unless you know something about testing. And even then it gets complicated. So I think it's a really interesting piece.
Well, it's complicated because it's not just adding up and subtracting or multiplying. It's actually modeling. And I think that's where we're seeing a lot of the confusion. It's not like election polling, but because we don't have a lot of the parameters that we usually would have in order to make our judgments in the models. There's a lot of guesses that are being used in order, and assumptions that are being used in order to create these particular forecasting models. But it is modeling, and which means that you have to make your best guess. I think 538 has been doing something also, not just with their forecasting and their modeling themselves, but they've also been talking to experts around the country to get a sense of how they're adding the numbers up. And on the one hand, that can be helpful. On the other hand, it can be very confusing because everybody has a different approach. Everybody has different assumptions. And so what happens, very much like when we're looking at election polling, you're looking at these very wide margins of probability. So when you see something, well, it can be 50,000 people or 50,000 cases of people who have been infected to 50 million people that can be affected. That's very wide range. I'm not so sure how helpful that is, but Nate has been very serious about trying to make sense of that all. Of all
so
of that.
one of the things that he's pointed out is that there are a wide variation of numbers on actual numbers on real data. For instance, the number of coronavirus-related deaths, that there is not even agreement on that, let alone the modeling that we've been talking about. So, for instance, are there going to be 100,000 deaths in the U.S. or 1 million deaths in the U.S. related to this? That's a factor of 10. That's a huge range, and the forecasts go beyond that. So I think what was interesting when I read through this was, if nothing else, it helped me understand better that we're talking about, when we talk about these statistics, we're talking about statistics that we don't know. You know, they're things that we will know in the future, but we don't know in real time because the pandemic is going on right now. And the models are based on data that is unbaked, half-baked, not unreliable, but half-baked.
Not baked. I mean, it's not baked. So, for instance, one of the criteria that anybody who's trying to get a sense of forecasting this, and understand this is an important thing to do. This is how information is provided to decision makers. This is how people are trying to disseminate resources and supplies, figure out how many hospital beds might be needed, ventilators. So it's not just an academic exercise. And I think what is particularly difficult is because we don't have exact numbers, and because the testing and many of the other factors that might go into a model have not been consistent across states and across the country, it's made it particularly difficult. I mentioned one factor, and that is the testing. And I know, Lee, you were focusing a lot on the fact that the testing itself is very inconsistent.
Yeah, and I wanted to point out, and first of all, we have to understand that the tests that are being conducted, the medical tests, are different in this article than the different methodological tests, the assumptions people in that
the statistical testing.
The statistical
right.
tests.
Two different types of tests.
For those who want to jump into this article, and I think it was very helpful, you have to understand just preliminarily that the word test is used in two different ways in this. But in the real world testing, clearly
of the COVID-19.
Yes, and how are people scoring and the incidence of that? It's really to allocate resources. In other words, where do we put ventilators? Where do we put? Where's there a need for more hospital beds? All those kinds of issues. And clearly, the goal there at this point is not necessarily to put together some epidemiological data set that could be clearly studied, which we couldn't have anyway. And Nate points out a whole bunch of things. There's a long lag time. People with symptoms, he assumes, are trying to get tested. Maybe so, maybe not. You can have the symptoms, yes, but you don't necessarily have to have the illness. There's just a whole bunch of assumptions on how many people have it severe, mild, or are asymptomatic. And what he's able to do in this is sort of work through these and many other assumptions in a highly uncertain environment to get a better handle on this. And we know, just having watched the numbers casually and not studying as precisely as this, that the cases were going to go up in large numbers as the tests went up. So you have different countries and different parts in this country who are doing more tests or even better tests, and what you end up with a different case total, number of people who are affected. And maybe that situation is, even though the cases are going up, maybe the situation's more under control. It's just that we have more cases because we have better tests, or maybe we have fewer tests, and that makes for fewer cases, but that situation might actually be worse because we don't have enough tests. So lots of comparisons can be difficult.
I think sometimes some people felt that it didn't really matter whether people got tested or not, or whether there was some consistency across the country for testing. One of the difficulties is what you mentioned, Lee, is it's an allocation of resources. So countries that could do testing quickly were able to, first of all, close down areas that appear to be hotspots, and then they could further allocate resources to those hotspots.
Exactly.
Now, New York and Washington State were two very significant hotspots, as was California. In the case of California and New York, to a certain degree, they were large. They were also very large population centers, and there was an incredible amount of testing that was also done. So we don't really have an understanding, and it's going to take some time to actually have a good understanding of what the impact of the pandemic was to the population as a whole.
And I think, Barb, why don't you finish that point, then I'll jump in.
No, it's just that I know that in the summertime, when we think are going to be able at least to get to a point where I don't think there's a normal, but there may be a new normal, we're going to have a moment, and I believe the CDC, the Centers for Disease Control, will be conducting a study this summer through random sampling of antibody tests. And I think that will give us a better sense of what transpired during these last several months, and also perhaps what we have ahead of us. Should this be a virus that can recur like other viruses have in the past? Yeah,
and that's exactly what a New York Times article today talked about. And the question is, when do we know we've recovered? When do we know we can open this up? And the choice we may have from a policy vantage point, the choice between, do we end up with a second wave, or do we end up pushing the date for restarting the economy? And the question becomes, how do you know that? And can the hospitals safely treat all patients who need it? Can everyone with symptoms be tested? Can all confirmed cases and their contacts be monitored? And can the number of cases has to be falling at least within 14 days? That's those guidelines. We're going to be debating that, I think, a lot as a society. And I think knowing the cases stuff and the points that Nate has pointed out in his article is very helpful for.
Well, understand though, there is a question, and people have been debating the issue of social distancing. And I think one of the things that we do have to keep in mind is, with social distancing and with the shutdown of the economy, what did occur was it allowed the healthcare system to at least be able to adapt, adjust, and deal with the upsurge of the illness. So I think going forward, there's certainly a lot more to discuss, and hopefully we'll get some numbers and answers.
I think the interesting thing, we need to move on, but we'll come back to this, but we've talked a lot about trust in institutions, faith in institutions, and all these numbers being so slippery, I just think is going to have a major impact on that. But let's talk about the census. That is something that we've talked a lot about on this show in the past, for good reason. The census provides the basis for what we do. Without the census, without knowing what the population looks like, it's impossible to do scientific, statistically valid polling. And so the census is really the root, the foundation of the entire modern polling industry. The census, we talked a lot about it because there were issues regarding questions that would be asked about citizenship, but now we're talking about it because the census involves two things. One, people either mailing in or doing online their census, and then people going door to door, knocking on doors, trying to get the people to answer who haven't answered. And how does that happen in the era of pandemic when you don't want to answer to the door to anybody?
Yeah, and Barb, you just made the point about social distancing. Continue in that vein when we're talking about the census and people going door to door.
Well, you know, the census, you know, they've been planning this literally for 10 years. I mean, as soon as the last census is done, they start the planning for the next one. And certainly they have tried to think of every possible scenario that can occur. They did not have pandemic on the list of things that might happen during the, you know, collection of data for the census in 2020. It's something that I know that they didn't anticipate. Obviously, the most obvious issue is this issue of going door to door, and the census has suspended all face-to-face interviewing, obviously, because of all the social distancing requirements and stay-at-home laws. But the other issue, too, is that because of these stay-at-home laws, understand the census is probably going to hire 500,000 census takers over the year. They're kind of short on a workforce right now because people are not allowed to go to work, and this is not considered an essential service. So one of the things they are doing, and yes, there's mail, you can mail it in, you can go online. There is face-to-face eventually, I suspect, but also people can literally phone it in, although it doesn't help the groups that tend to be most undercounted, which we've discussed in the past as well.
Yeah, and I think, you know, it becomes a problem. And I'm thinking back to what we just talked about with the Nate Silver article. There you have the uncertainty because you don't know how many cases there's. When here, we got to find the cases and we have to find the numbers. And it's going to be very much more difficult, not only for this, you know, we've talked about also, you know, how we do the elections in the fall. You know, how do you know, do that kind of situation, pull that off in this current climate? So I think we're really being tested in a whole wide range of ways.
The idea behind the census is that everyone does count, and we have to count everyone. So places where census takers have a very large role is for people who live in group settings. So you have nursing homes, you have prisons. Those are places where you actually have to go. I mean, door to door is kind of not quite the right visual, but where you have to go into those institutions and count individuals. And then, of course, we still have the issues that has always plagued in a different way than pandemic, the census count, which is those populations that are really hard and those people who are really hard to get in touch with, people who are homeless, people who move about, you know, often. I know when I filled out the census, it was, well, where are you living on April 1st in 2020? And so they make it very specific so that when you do fill it out at another point in time, you do have a sense of a time and place where you were in order to be able to fill it out. As of right now, I think they've said about 38% of Americans have filled it out. And so we still have a very, very long way to go.
Seems to me this opens up the possibility that I mentioned at the very end of the last segment, which is, again, this lack of faith in institutions, that when there are going to be people almost guaranteed on many sides of this arguing that the census count is incorrect, incomplete, whatever it is. That always happens. I mean, New York is pretty famous for arguing that New York has been undercounted in the census. Happened in 2010, happened in 2000, happened in the 1990s. That's a consistent theme, at least in New York and a couple other states. What happens now, though, when the census in an unprecedented era or in an unprecedented situation is not able to do what everybody thinks that they should and can do? I mean, does this open up that possibility of a lot of people, a lot more people saying, the census, you can't trust that. If you can't trust the census, what can you trust?
Yeah.
Well, I think that the census is going to continue to try to have business as usual. I have seen that the tentative date for census takers to be able to do face-to-face interviews is May 28th. And that's pretty close to the time. I think it's only off about a week or so from when they had planned to do that, and that will go through August. So hopefully through the summer months, they will get that opportunity to do that. And I think that they have, the census also has people called census advocates in communities around the country that try to, they're within each community and they are trying to get people to pay attention, to participate, to be counted. And I think that they, just have to kind of change some of their tactics. So they'll be going to, phone banks and probably flyers on supermarkets and in community places that people pass, regardless of whether we're allowed to gather as groups. But yeah, go ahead, Lee.
Yeah, I was just going to say, and hopefully this works because we don't want to have to go to some kind of plan B because there is a time limit the end of this calendar year for the submission of the census, and there would have to be some major gymnastics to create a sliding deadline there. But to Jay's point, I think that we are going to hear the words overcount and undercount being used depending on where you are in the political world, because these numbers form the basis of so much for the next decade, not the least of which is the proportion of the Electoral College from each state, number of congressmen, allocation of resources, and all those kinds of things.
Yeah,
money.
On that note, I think that could bring us to a close. On the edition of Poll Hub, which is a production of the Marist Poll at Marist College in Poughkeepsie, New York, and Mary Griffith, who we're very happy to have as our executive producer, and Casey Schaff will be, again, doing our editing. We are remote, and we're pulling this off, folks.
Well, hopefully. And thanks to the Roper Center Archive at Cornell University, providing us with the ability to look back at survey questions and results over the decades. And actually, it's a great place to take a look if you want to peruse some data, because they actually have a couple of features, one on the coronavirus and the polling, all the polling that has been publicly done up until this point, and they are updating it as we go along. And certainly if you have questions or comments, reach out to us on social media. We're at Marist Poll on Twitter and Marist Poll on Facebook and Instagram.
And as you're spending more time at home, maybe you have a little extra time to listen to a podcast, to do something that you wouldn't normally do. Well, here's a suggestion. We've got an online learning academy. It's called the Academy, Poll Hub Academy. It's an online learning portal. It's free, and it has tons of information about polling, the details of polling, the ins and outs, all the kinds of stuff, the questions that we try and answer here. You can dive in and learn at your own pace. Would recommend you stop by and take a look. You got a lot of time, right? Everybody's got time on their hands, except if you have kids, right, Mary? Anyway, thanks for joining us this week. Stay safe, stay healthy, and we will be back next week. We'll see you then.